Chapter 21, Toxicology. This chapter is going to cover the poisonings and overdoses that we see and how we take in the poison. It's important to know that poisoning affects 2 million people each year. The problem we come across is more chronic poisoning. It actually affects more people. So acute poisoning being that immediate exposure to a poisoning, the chronic poisoning being a long-term exposure. We are actually starting to see fewer deaths by poisoning, especially in the children, because of the increase in child safety caps, child-resistant locks, those types of things. But we do see an increase in the chronic poisoning deaths, mostly as the result of chronic drug abuse in adults. Know that toxicology is the study of toxins or poisonous substances. And there is a difference. So a poison is a substance whose chemical action damages or impairs body function or structures. So that is a poison. Toxins are poisonous substances produced by bacteria, animals, or plants. So if it comes from an animal, a plant, or a bacteria, it's going to be a toxin. And a toxin is poisonous. Substance abuse is the misuse of any substance to produce a desired effect. So it may be a substance that has a standard use, alcohol. However, misuse of alcohol or misuse of a painkiller for a desired effect, normally outside of what the normal effect of that is considered substance abuse. And then overdose is a toxic dose of a drug. We, as the EMS provider, have the primary responsibility of recognizing the poisoning. It is not our job to have an intervention. It is not our job to clean out the medicine cabinets, but it is our job to recognize that the poisoning is occurring and to ensure that we are not being exposed to the poison and remove our patients from the poison. We have to recognize that even if the amount is small, some toxins can be highly deadly. And we have to begin emergency treatment as soon as we recognize what is going on. The signs and symptoms of a poisoning are going to vary depending on the type of poisoning and the method with which they were exposed to the poison. And we'll go all over that. Table 21-1 gives you the types of poisons and the signs and symptoms of suspected overdoses, those typical things that we'd expect to see. It starts with opiates or opioids. Then the sympathomimetics, those are the ones that kind of mimic what our body normally does, so like epinephrine, albuterol. The sedative hypnotics, your diazepam, midazolam. The anticholinergics, that is your atropine, your diphenhydramine, and your doxylamine, and the Jimson weed, which I've actually seen, and the signs and symptoms of that kind of overdose. And then the cholinergics, and obviously those are easier written than said. The cholinergics are those organophosphates, the nerve gases. We tend to think of those in relation to terrorist attacks. And when you look at the cholinergics, you need to remember the acronym SLUGM. SLUGM will tell you the signs and symptoms you expect to see. And in most exposures and poisonings of cholinergics, especially in a terrorist event, you're going to see it over a large number of people. So, write down table 21-1 and make sure you go study it. It's important also to identify what it is that they were exposed to that is causing the poisoning. not only what it is, but how they were exposed to it. Did they eat it, drink it? Did they absorb it in their skin, breathe it in? Have they attempted to take anything afterwards to counteract it? It's important to know how much they weigh, because each of these can play a role in how quickly the body can metabolize it, absorb it. Like we've talked about with drugs, if you ingest it, it can take 30 minutes to break down and absorb into the system. But if you inject it, it's immediately into the bloodstream. So, as you are gathering data and interviewing your patient, it's going to be important to ask those kinds of questions. Try to determine, is it some potentially a criminal act, or is this an accidental? Maybe it was an attempted suicide in all this. Look for clues. Do you see empty pill bottles? Do you see syringes? Signs and symptoms that this is something that is going to be bigger, multiple people who are down. If you've got containers that you can take with you, they can also provide clues and information to the hospital when you get the patient there. Obviously, don't take those if it's going to be a hazard for you to take them with you, though. If the patient vomits, hopefully you've given them a container to vomit into. Look at the vomit. And I know that sounds exciting, but are there pill fragments? Can you tell what color is it? Does it have an odor? Take the vomit with you and provide it to the hospital for them to see. Make sure that you're wearing appropriate PPE and that you are ensuring scene safety. If this is a poisoning, such as carbon monoxide, just entering the scene can actually be a hazard to you as well. So, how can poisons enter the body? Well, you have to consider the fact that from the minute a poison enters the body, it's going to increase the potential that you're going to be dealing with significant issues. And how the poison enters the body can actually give you an idea of the body systems that are going to be impacted as well. The thing to remember is that if you can remove the patient from the poison or remove the poison from the patient, that is the best treatment you can provide for that individual. How we treat them depends on how the poison enters the body. And there are 4 routes that we need to consider: inhalation, absorption, ingestion, and injection. Each of those provide an opportunity for the poison to get into the bloodstream and to cause havoc on the body systems. Inhalation, we tend to see that, so you can, especially with all of the COVID stuff, there was a lot of reminders about which cleaning chemicals not to mix because they would cause big issues and cause inhalation injuries or poisonings. In the abuse area, we might see patients who are huffing paints or spray cans. Absorption, it gets on the skin and is absorbed into the bloodstream through the skin. Ingestion, we tend to think of eating, drinking in pill form, and then injection. Most of the time, this is going to be an abused drug. But we have, in the terrorist realm of things, seen people inject poisons as a way to commit a terrorist act. Obviously, we're not seeing a lot of that, but it does exist. All of these can lead to life-threatening issues. And most importantly, you don't necessarily need to know how it got in, but when in doubt, know that poison control and the number to poison control can provide you information. So having poison control's phone number plugged into your phone, just in case you run a call, is going to help you understand because they have access to the information, they have access to the problems, and they actually can tell you about the treatment as well. If it's an inhaled poison, This says move the patient into the fresh air immediately first. Actually, first is going to make sure that you are not going to be exposed to that poison when you step onto the scene. So if there's a green cloud laying over the scene and you have to drive into it to get to the patient, that's probably a bad idea. Okay? But once it is safe for you to enter, move the patient away from it. Make sure that you get appropriate support. You know, if you've got a bunch of people complaining of difficulty breathing and there's an odor, get hazmat. This is where you request assistance. Consider the fact that your patient has probably absorbed some of that poison into their shirts and into their clothing. You know, if you've ever gone into a bar and you're not a smoker, but you walk out of that bar where there was smoking, you're going to smell like it. Why? Because you absorb it into your clothing. So we need to consider having to remove clothing as well. Decon is that removal of the clothing. We might need to rinse them off. We might need to, you know, flush them down so that we are not getting exposed at all. The other thing to consider is the fact that this patient who inhaled a poison may actually be generating toxic gas when they exhale. It's one of the reasons that most of your helicopters will not transport patients who have been in hazmat scenes because the off-gassing can become hazardous. Supplemental oxygen is going to be very important here. The inhaled poison is wreaking havoc on the respiratory system. And so we know that supplemental oxygen is going to be the way to go with these people. You know, unfortunately, we're seeing a lot of increase in chemical suicides. So where people will mix chemicals that they know will cause respiratory arrest, that will kill them, and creating a system where when we open the door, it will actually cause us respiratory harm as well. People who don't want us to get hurt are actually putting signs on the outside of their car or the room saying, hey, don't come in here. But obviously that's something that we have to be concerned with. So always know what you're getting into and don't enter a scene if you're not 100% certain. Absorbed and surface contact with poisons can affect the patient in many ways. So absorbed poisons are normally going to come in through the skin or mucous membranes or splash into the eye and cause damage to those areas. You may get burns as the body is reacting to the poison that it is absorbing. Rashes or lesions may begin to form because you get contact dermatitis. So not only is it impacting the internal systems, but it's going to impact the external as well. You've obviously got to be able to tell the difference between a contact burn, so it's quick but creating a burn, and contact absorption, where you've got the damage on top of the skin, but you need to be aware of the things that are happening underneath as well. Some of the signs and symptoms associated with absorbed and surface contact poisons are listed on the slide. So obviously anybody who has a history of an exposure, we need to be concerned. If there is liquid or powder on the skin still, you need to note that, but also be cautious. Burns, itching, irritation, or redness or irritation on the skin, and then odors of typical substances. So certain chemicals, certain powders have an odor. And when you have that smell and a patient who exhibits some of those signs and symptoms, then obviously you need to be suspicious that that's what this is. What's our emergency treatment? Well, just like your inhaled poison, you need to put top priority to your safety. Especially if they still have powders or liquids on their skin, there is a good chance that you could become exposed. If they're lying in it, you need to be cautious. We need to remove the patient from the substance or the substance from the patient as quickly as possible. If it is a powder, we need to brush the powder off the skin before we flush it. because there are some substances that exist in powder form, but when they come in contact with water will actually react and cause burns, etc. So decontamination of our patient is key, knowing that we need to either flush and then remove clothing, or that we need to brush and then flush so that our patient is taken care of. And that's exactly what this next slide says. So here I am getting ahead. If it's a dry powder, brush the powder off, obviously not brushing it just crazy so that it's all in this air and you don't breathe it in. And then flush the skin with water for 15 to 20 minutes. You're not necessarily going to have sources of water for 15 to 20 minutes in an emergency scene. So one of the things to consider is taking a bottle of sterile saline, poking a hole in the top, and then using it like a squirt bottle. But the concern here is don't just flush it out into the environment. If you've put them in the back of the truck doing this, put that extremity or whatever it is over a trash can to collect the fluid. Okay, and then if it is a liquid, then immediately flush for 15 to 20 minutes or as long as you can. Obviously, if this is a life-threatening emergency, you're not going to sit on scene for 15 minutes to just brush off and flush the skin. If it's into the eye, you definitely want to irrigate quickly and thoroughly. And what you see here is using either an IV solution, like IV tubing, or some other way, again, using normal saline bottle with a hole poked in it. The goal here is not to flush the water into the opposite eye. So you want to flush the eye from the inside, so towards the bridge of the nose, out. If it has occurred, this chemical burn or this exposure in an industrial setting, it's possible that they've already taken a shower, because safety showers are required in certain areas, in certain businesses. And, you know, in those types of settings, especially in the industrial setting, you definitely want to involve the hazmat, although they may already have one, depending on who it is. Depending on the business, they might already have a hazmat team that is on scene in the building. But our goal, of course, is making sure that they are deconned and then getting them to the hospital to get additional assistance. Ingested poisonings represent about 80% of the poisonings that occur in the United States. So taking the poison in by mouth, whether it's in liquid or solid form, is the greatest risk that we see. And that can be anything, a liquid, a solid, a cleaner, bad food, a plant, or drugs. Because you've got to figure that food poisoning is called food poisoning for a reason. In our children, it's normally accidental. They normally get into something, parents didn't lock something up, you know, they're just curious kids. In adults, it tends to be deliberate. And some of the things we need to consider are, what was the type of poison? What is the age of the patient? And how long has it been since they ingested the poison? Each of those is going to play a role in determining what signs and symptoms we would expect to see. For the most part, we expect to see burns, especially if it's a chemical or a household cleaning product, gastrointestinal discomfort and pain, vomiting or diarrhea, cardiac dysrhythmias, so an abnormal heart rhythm, and seizures if it's significant enough. The diarrhea will come if the food has been in their system long enough, but obviously that's not going to be an immediate reaction that we see in patients who have ingested a poison. We need to treat the signs and symptoms. If our patient is presenting with difficulty breathing, we need to give them oxygen. If they're vomiting, we need to be prepared for suction. But for the most part, there's not a lot we can do for ingested poisonings. The hospital is going to do some things, but our goal is to get them to the hospital. we have to consider whether or not what we do have at our disposal for activity for treatment is something that will be helpful. And that is, can we prevent the body from absorbing additional levels of the poison that has been ingested? If that answer is yes, then we need to consider whether activated charcoal is appropriate. Activated charcoal is designed to adhere to the ingested poison. So it's only good for an ingested poison, and it's only good if that poison did not burn the patient when they ingested it. Because one of the side effects of activated charcoal is nausea and vomiting. And obviously, if a poison burned going down, it is going to burn coming up. And we do not want to cause additional damage to our patient as a result. We always want to assess the ABCs and do full assessment appropriately before giving this medication. And this is a medication that does not require a prescription. It is one that we carry on our trucks. And finally, there is injected poisonings. Injected poisons are put in through the skin into the bloodstream. So along with our IV drug abuse, we also have insects, spiders, and snakes that can inject venom, poisonous venom, into us. And that is obviously going to be a problem as well. Because it goes into the muscle or into the bloodstream, it is going to be quickly absorbed and begin causing tissue destruction very rapidly. And the problem we have is that once it's in the system, in the bloodstream, we can't remove it. So we've got to treat the signs and symptoms and be prepared for issues. So the signs and symptoms associated with injected poisons include weakness, dizziness, fever, chills, unresponsiveness, or it could be that it causes excitability. It's going to be important that we monitor airway, we be alert for those altered levels of consciousness, and we consider if it is an insect bite or a reptile bite. We consider the impacts of swelling in the extremities and remove any watches, bracelets, or other jewelry that may become a problem.